Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about a relatively complicated topic, but incredibly important and frequently misunderstood topic, and that has to do with fats and, well, quite frankly, your risk of dying. The whole 80s, 90s, and the fat guide pyramid really screwed everybody up. And we had a whole generation of people grown that were raised with the idea that fat equals fattening and bad, and we should avoid it and hit low fat. As a result of that, we started seeing increased rates of diabetes and heart disease and cancer, because rather than educate people about the right types of fats, we just told them to avoid fats altogether. Before we get into some of the details on this, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. So that being said, this was a study done out of the UK on almost 118,000 people followed for 12 years. Of that group, 6.6% of the people died. So it was a pretty big chunk of people to evaluate their fats and their risk of dying. What was interesting in this portion of the study is that they used serum, so the actual blood levels of certain fats, rather than relying on dietary recall, because we know that dietary recall can be a little bit challenging. And so it's a much clearer picture of what those fats in our bloodstream had to do with outcomes. So the two things that the big pictures they found was that the saturated fat, so those things, think of saturated fats are things that are solid at room temperature. You're going to find them in fatty meats and dairies, in tropical fats like palm oil, coconut oil, palm kernel oil. They were clearly linked to an increased rate of dying, which is generally not good. And the polyunsaturated fat, so think things like nuts and our omega-3 fatty acids, so like our fish oils, were linked to a lower rate of death. So in particularly linoleic acid, which is, this is an omega-6 polyunsaturated fat, but this is the one where people get a little bit confused on. Usually nuts can be high in linoleic acid. I still am not a terribly big fan of seed oils added in. I think a lot of that has to do with ratios, but think healthier omega-6 fatty acids, which you're going to get from a lot of nuts. They had a 30% lower risk of dying from cardiovascular disease-related causes, which is good. The omega-3s, our friends, our fish oils, were shown to have a 37% lower risk of cardiovascular mortality and a 24% lower risk of cancer death. Like, that's pretty staggering. Omega-3s are very easier to identify. It's your fish oils, ALA in flaxseed is going to be high in omega-3s as well. So those were generally good. I really think, in general, the polyunsaturated fats had to a lower, 34% lower rates of all cause of dying from anything. So that's breaking up into the omega-3 and the linoleic acid that we talked about. Personally, I think that the omega-3, omega-6 story has more to do with balance, that when we haven't, it's not about too much it's not about omega-6 by themselves, it's all about the balance between the two. But what was interesting, other omega-6s outside of linoleic acid actually increase the risk of cardiovascular death and cancer death. So the types of fat that we take in, the things we've talked about, things like fish oils, things like nuts without any added oils on them, and grass-fed beef, grass-fed and grass-finished, wild game, all of those things which have these fats that are consistent with lower rates of mortality, at least among the duration of this study. That hasn't changed, and this study just adds more dynamic to the story that healthy fats are good for us. It also raises the question of the whole carnivore craze, and most of those are animal-based saturated fat that are very low quality because the commercially raised cattle is just all kinds of things wrong with it. higher in the saturated fats, and they're going to be higher in the non-friendly omega-6 fatty acids. So I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.